Hi there. Picking up where we left off, on the last couple of videos, we talked about shoulder stretches and knee stretches. Today we want to talk briefly about the low back. And if we had to pick two stretches that you can simply do at home that would carry you through this period of time, then those two have to be a piriformis stretch. The piriformis is a fist-sized muscle that sits deep inside the buttocks, and it's important to stretch that muscle because the infamous sciatic nerve is leaving the low back, traveling through the piriformis muscle. So any spasm, any tightness in that muscle inherently is going to tug on the sciatic nerve and cause pain. So if we can keep that muscle relaxed, it's not going to fix all low back pain, but it's definitely going to help carry you through that period of time when you're mostly at home and likely seated. So Amanda is going to demonstrate a piriformis stretch. The key thing in all these stretches is when you get to that sweet spot, when you feel that the muscle is engaged and you are stretching, you have that good pain, you want to stay in that place for a good 20 seconds. That's how long it takes for the muscle to finally give in and relax. So she'll start by a piriformis stretch, then we're going to talk about some hip flexor stretch, which is also critical for low back pain management. And that would be it for today. On the next video, we're going to talk about some neck stretches that you can do at home. So please stay tuned. Go ahead.
All right, guys, so like Dr. Shani said, piriformis stretch, super important. You can do it on a low table, couch, chair, bed, whatever kind of works. So what you'll do is you'll start to either side. You're going to basically come up into a 90-degree position here. This back foot, you're going to kind of rest on that toe. Make sure you're squaring that pelvis up towards the leg that you're stretching. Sit up nice and tall, core is engaged to protect that low back. And then all you're going to do is just slowly start to lean into it until you feel a good stretch on that left glute, which is the side that we're stretching right now. And then like he said, you want to hold for 20 or 30 seconds. Make sure you keep that pelvis square, and then you'll switch and do the other side a couple times a day. For hip flexor, pretty simple, same thing. You can take a pillow if it does bug your knee. Hold on to whatever, it's not a balance test. Same thing, core is tight. You're in kind of a half lunge type position here. And then you're gonna keep that torso straight up and down. So try not to flex too far forward or extend too far back. Let this front knee do the work. You're just lunging in until you feel a good stretch on the front of this back leg. Same thing here, you'll hold for 20, 30 seconds, both sides, a couple times a day. And again, those are both targeted to help the low back. Hip flexor is important because it does come attached to that lower lumbar spine. So keeping that loose will help to keep you out of that anterior pelvic tilt position. So like Dr. Shani said, next time we'll talk about some neck stretches, and we look forward to seeing you then.